COVID-19 antigen rapid test cassette, Saliva, test procedure. Allow the test cassettes, reagents, and specimens to equilibrate to room temperature, 15 to 30 degrees or 59 to 86 Fahrenheit degrees prior to testing. The kit consists of package insert, test cassettes, extraction reagents, collection tubes, saliva collectors, droppers, workstation, sample collection. Use the collection tube and saliva collector to collect saliva. Insert the saliva collector into the collection tube. Then put the saliva collector close to lips and let the saliva flow into the collection tube. The volume of saliva needs to be at the scale mark approximately 300 microliters. If the volume of saliva is too much, use a dropper to remove the excess saliva until the final solution at the scale mark. Test procedure. Place the collection tube with saliva collector, which has saliva in the workstation. Unscrew the lid of an extraction reagent. Add all of the extraction reagents into the collection tube. Discard the saliva collector. Cover the collection tube with a dropper tip onto the collection tube. Shake the collection tube more than 3 times vigorously to mix the saliva and extraction reagent. Then squeeze the mixed solution 10 times to allow the saliva to be thoroughly mixed. Remove the test cassette from the sealed pouch. Place the test cassette on a dry, flat surface. Reverse the collection tube, holding the tube upright. Transfer 3 drops, approximately 100 microliters, slowly to the specimen well of the test cassette. Start the timer and wait for color lines to appear. Interpret the test results at 15 minutes. Do not read results after 20 minutes. Interpretation of results. Positive. 2 lines appear. 1 color line appears at the control region, and another color line appears at the test region, regardless of the intensity of the test line. Negative. 1 color line appears at the control region, and no line appears at the test region. Invalid. Control line fails to appear. Insufficient specimen volume or incorrect procedure techniques are the most likely reason for control line failure. Review the procedure and repeat the test using a new test cassette. The used test cassette should be discarded according to federal, state, and local regulations. Limitations. The product is limited to provide a qualitative detection. The intensity of the test line does not necessarily correlate to the concentration of the antigen in the specimens. Negative results do not preclude SARS-CoV-2 infection and should not be used as the sole basis for patient management decisions. A physician must interpret the results in conjunction with the patient's history, physical findings, and other diagnostic procedures. A negative result can occur if the quantity of SARS-CoV-2 antigens present in the specimen is below the detection threshold of the assay, or the virus has undergone minor amino acid mutations in the target epitope region recognized by monoclonal antibodies utilized in the test.